Hello everyone and welcome to my presentation. For this assignment, our class has been tasked with examining either a piece of policy or legislation within the domain of healthcare. An integral component of this presentation is that it should be highly relevant to our current or future careers. And with that being said, I've chosen to analyze and discuss hospital visitation policy, as I'll soon work in the capacity of an administrative fellow in the state of Maryland. Hospital visitation policies have been in flux over the course of the COVID-19 pandemic, and I see this topic as something I could possibly have my hands on as we continue our efforts to mitigate the virus's spread. So I've included my email here if you'd like to reach out after the presentation for any questions or lingering concerns. So let's get into it. So just a little bit about how the structure of this presentation will look. We're first going to try and understand the background of how visitation policy has become such a hot talking point over the past 2 years. Then we're going to look at some of the recommendations the CDC has made in regard to visitation policies amidst the COVID-19 pandemic. We're then going to analyze hospital-specific examples of a visitation policy currently in place. We'll then briefly discuss some of the public perception and outcry regarding these policies. We'll analyze the policy's overarching impact and then draw some conclusions as pertaining to where these types of policies are headed and discuss its future. So first off, we're going to start with a little bit of background surrounding hospital visitation policies. So the COVID-19 pandemic, as we all know, began sweeping across the country in the early half of 2020. And COVID took a massive toll on the American healthcare system. And it was very apparent early on that we were woefully unprepared for a pandemic of such magnitude. It quickly became the responsibility of hospitals and health systems across the country to do everything within their power to mitigate the spread of COVID-19 within a patient care settings. This brought about the necessity for policymakers within hospital facilities to create hospital-specific policies and guidelines surrounding patient visitation. In crafting such policy, there are many factors that go into play. A few of note would be geographic location, COVID-19 spread within the immediate community, community demographics, and the federal recommendations regarding such policy. So a little more on the background of hospital visitation policies. According to studies conducted in Canada, much of the policy restricting visitation access can be supported in historical context surrounding past pandemics. So according to hospital-based data from Taiwan and Toronto during the 2003 SARS pandemic, it was found that 28% to 38% of individuals infected with the virus were hospital and visitors. So according to this data, this would support the decision of hospitals to implement more strict guidelines as pertaining to their hospital visitation restrictions. So one of the organizations that's really led the charge in the mitigation of the COVID-19 pandemic has been the CDC. And the CDC has had their hand in a number of policy measures, whether that be on a local, state, or federal level. And they've also given recommendations as pertaining to specific policies. And one of these policies would be hospital visitation policies. So one of their first recommendations surrounds a designated entrance and exit for all visitors. And this is the first point of contact for all visitors. And this allows front desk staff to have the opportunity to run a thorough screening on all visitors that come into the facility. So as you can see here on the right, I have a COVID-19 screening checklist, which would include some of the most common questions that front desk personnel would ask visitors throughout the screening process. And I can almost guarantee that if you've been to a hospital within the past 2 years, these are some of the questions that you would be asked. Those questions go as followed. Have you had a cough? Have you had a fever? Have you been around anyone with these symptoms in the past 2 weeks? And are you living with anyone who is sick or quarantined? And lastly, one of the most important things that the CDC recommends is proper education of all visitors within the facility. And some of the things that clinical staff can educate visitors on would be proper hygiene in terms of proper washing of hands, transmission risk associated with the COVID-19 pandemic, and lastly, cough etiquette, which is something that a lot of people need to be informed upon. And these are all critical in terms of mitigating the spread of COVID-19 throughout the facility. So one of the core elements of this assignment is that the policy that or legislation that we have chosen should be applicable in a professional setting or helpful in our future careers. So Meritus Health is a health system located in Hagerstown, Maryland, and is the organization I will be employed at post-graduation. So for the purposes of my policy that I've chosen, being hospital visitation policy, I think it's important to look at kind of how their hospital visitation policy has evolved and use this as my example moving forward throughout the course of my presentation. Getting into some of the specifics of Meritus Health's visitation policy, as you can see, their policy is broken into a four-pronged, color-coded system that would indicate the level of access a visitor would have while inside the hospital. Now, referencing the right of the screen, you can see that the levels range from green to yellow to orange to red, with each subsequent level indicating a heightened level of restriction for the visitor. For example, when COVID numbers are lower, one could expect the facility to lie within the green or yellow range. On the other hand, in times of increased COVID spread, the facility would move into either orange or red to ensure the safety of their patients. This type of system offers significant flexibility for the facility as they are able to adapt the level of restriction in accordance to current trends in COVID spread within the Hagerstown area. So when discussing hospital visitation policies, it is also important to discuss the public perception surrounding such policies. Nationally, there has been a fair amount of pushback, backlash, and dissent regarding the tailored visitation policies that have been implemented, which is understandable from the perspective of the patient and visitor. However, organizations have to put the health and safety of the patient above all else, and there have to be measures in place to adequately enforce the policies laid out by the hospital. If compliance on the end of the visitor is not an option, it then would be appropriate to remove them from the premises of the facility. Keeping patients and their loved ones apart can be such a difficult task for policymakers to follow through on, and the policies themselves are so multidimensional as each party between the patient, visitor, and policymaker share differing perspectives on the matter. It is almost certain that these policies will not gain popularity in the public eye, but they will be around indefinitely. So moving on to the more broad impact of hospital visitation policies amidst the COVID-19 pandemic, while intended to mitigate the spread of COVID-19, visitation policies have had their fair share of unintended consequences. First, it's had an effect on the line of communication between patient and clinician. More specifically, it could be stated that visitors often serve as a second set of ears for the patient. Their capacity to understand plans of care upon discharge may differ from the understanding of the patient themselves. This greatly ties into issues surrounding health literacy. Another unintended consequence has to do with the high levels of anxiety a patient may go through during their hospital stay, especially in the midst of a global pandemic. Loved ones provide that kind of peace of mind and serve as a security blanket to patients during their hospital stay. Finally, there have been unintended consequences associated with labor and delivery. Studies have shown that having the support of a partner during labor can lead to better health outcomes for both the mother and the child. And unfortunately, these aren't the only unintended consequences that have been able to be observed throughout the COVID-19 pandemic in the hospital visitation policies that have been implemented. So, in discussing the impact of these policies a bit more, it has been found that nursing staff, their psychological health and well-being has been significantly impacted by the implementation of these visitation policies. And this type of impact has come from being forced to observe patients suffer in isolation with very limited family support during their hospital stay. And with burnout and labor shortages, these types of difficulties with mental health don't really bode well in terms of staff retainment and turnover. Additionally, families with lower socioeconomic status may face barriers in technology access to regularly check on their loved ones during their hospital stay. So, for example, a lot of hospitals in the country have utilized services such as FaceTime to facilitate contact between the patient and their family. And without the financial means to access this type of technology, they're then left in a situation where their contact with their loved ones in the hospital may be really limited. And last of all, a lack of visitors has led to safety concerns for the patient. Nurses must tend to multiple patients at a time and can't devote the entirety of their time to a single patient. With that being said, sometimes the keen eye of a visitor may be necessary in spotting the deterioration of a patient's condition or preventing a patient fall. These are unfortunately all factors that have been brought about by visitation restrictions in health systems across the country. So now in the spirit of kind of wrapping things up, it is obvious that there was positive intent with hospital visitation policy that really turned into unexpected ramifications. It's also supported by research that having the support of loved ones and visitors actually does play a role in optimizing the health outcomes for patients within hospital facilities. And looking at some of these types of policies moving forward, it would be my opinion that the color-coded system, such as that we discussed with Meritus Health, would be the best type of compromise between the facility and those hoping to visit. And it is important to understand that these restrictions will not be going anywhere as long as COVID-19 is still a threat to patient health and safety. And just like any other aspect of life, COVID-19 has brought about change that will most likely be indefinite, especially in the American healthcare system. So visitors have to continue to adhere to the policies in place, and their pushback negatively impacts everyone involved, especially the patient. So within this slide are both the references that I used for the purposes of this presentation, with a few extra examples added in of hospital-specific COVID-19 visitation guidelines. The two examples that I've included are both regional health systems in UPMC and WVU Medicine. I would highly suggest to anyone with any lingering interest in the topic to take a look at these sites to kind of further their understanding of the topic. And with that, thank you anyone who has viewed this presentation. I really enjoyed the topic, and I look forward to potentially working with such policy in my future career. I want to let you all know again that my email is included on the first slide, and I'd be happy to hear any feedback or answer any lingering questions you may have regarding the topic. Again, thank you all so much for viewing.